Welcome back to another segment of the Marc Steiner Show right here on the Real News Network. Good to have you with us once again. We continue our look today about what happened at Franklin Square Hospital in Baltimore with the MedStar Corporation closing an entire pediatric unit and what it has meant. Today we have a different guest talking about a different aspect of what that means for all of us, because it's probably coming to a community near you no matter where you live in this United States. One of our guests this hour, the Reverend Annie Chambers, is the Green Party's Lieutenant Governor candidate here in the state of Maryland. Yes. She is an advocate, a patient at that hospital, and an advocate organizing people around MedStar to fight back on the closing unit. Good to have you with us here.
Thank you.
And with her is Dr. Margaret Flowers, who in past years has been a guest on my other show many times. Good to see you again, Margaret.
Great to be here.
And Margaret is now the co-founder of the Maryland Healthcare for Human Rights and coordinator of Health Over Profit for Everyone, which is fighting for single payer across this country. Good to have you both with us. So let's talk a bit about, first of all, what you began organizing in the wake of the closing of this pediatric unit. So, and let me start with you.
Well, I'm, I guess, a career organizer, but...
Yes, you are.
when I went to one of my apartments, that's how I found out about it.
When you say one of your apartments, because you live in public housing and you're organizing in the
apartment.
I think it's apartments.
Yeah,
right?
I live in public housing. I, live right in the heart of the communities. But when I went to my apartment, and there were people in my doctor's office, crying. And these were, often we go there, we socialize, we talk, everybody knows me. And they were telling me they couldn't come to see the doctor anymore.
And your doctor was Dr. Dillon, who was on our last segment.
Dillon, yes.
Right.
They couldn't come to see Dr. Dillon anymore because they were told they were sent a card and saying that they had to, could not see him anymore. He wasn't on the rolls of their healthcare providers, which was MedStar. And they didn't understand it, and I didn't understand it, and people were saying, well, maybe Dr. Dillon really don't, really want, but that wasn't the case. The case was that they had taken all of medical care and Medicaid patients and away and sent them to the, I call them the little basement clinics. Where, we have had bad experience. When I say we, even myself, have had bad experience in these clinics where there's no real workup of you when you go in there. You can go, I have experience that I can give you of patients that have, went there with a heart attack, and I'm one of them in one of these clinics. And they never told me I was having a heart attack. I wound up in the emergency room with fluid done, covered my body, covered me. So there's such a thing as patient rights, Bill of Rights. It's like we don't have sense enough or know enough to know that we can, say no to this. They just, have been bogarting people, so bullying people, and now my thing is, and along with others, is to organize people and to say that we won't allow this to happen to us. Most people can get a second opinion. If we can't even get a first opinion. You're going to accept whatever they tell you and leave. You can have diabetes, which is very high in poor people's community, heart conditions, strokes, and all of these things happen daily to people because we trying to survive. All these things are upon us. We don't have proper stores. We live in food deserts, so people tend to eat whatever. And so we're fighting to make a change in our health condition, and they have just turned it back, all of Obamacare. And for MedStar to come in and do what they're doing, we won't accept it. So yes, we are organizing against them.
So Margaret Flowers, you've been involved in this struggle around single-payer health care for a while now. So how does this all fit in? I mean, what just happened at MedStar in terms of kind of your analysis of what's going on in the country with the corporatization of medicine and and the battle around single payer. How does this all fit in together?
Well, and what Annie outlined and the doctors Reed and Dylan spoke about in the last segment really shows that we have a, the only industrialized nation in the world that has a market-based system that treats healthcare as a commodity and not as a public good or as a human right. And so we're seeing hospitals, we're seeing giant medical corporations, and MedStar is one of them, that are really doing what's called vertical integration, where they're just gobbling up hospitals, long-term care centers, laboratories, rehab centers, physician practices. They have their own insurance. They make their own products and devices that they sell to their own corporations, and this huge consolidation of the medical industry. And with no regard for the patient, if some sector of that is not making money for them, they just get rid of it. So what happened at Franklin Square with the pediatrics also happened there with the obstetricians. They've also closed down, psychiatry departments, essential service kind of departments. And what's interesting is it's being done in a very discriminatory way. So at Franklin Square Hospital, half of the pediatric population they serve were Medicaid patients. At Union Memorial, Dr. Dillon's patients that were MedStar patients were Medicaid patients. They reassigned all the Medicaid patients off campus to these basement clinics, but the Medicare Advantage patients, which pay more, they kept them on campus. And so I think you remember the days, or know the stories, Annie, I know you know, the civil rights time when hospitals didn't serve the community because of your skin color. Well, now they're not going to serve the community because you're not a wealthy enough patient to be in their hospital. And that's where we're going with this whole
So when you say basement clinics, what do you mean? Annie used the word, you just used the word. What do you mean by basement clinic?
Well, so Medicaid, which is the public health insurance for poor people.
Right.
Most of our Medicaid now is privatized. It's run by private health insurance managed care organizations who contract with the state.
Even though it's a federal government agency and it's a federal program.
It's a federally funded program that's run by each individual state. That's how it's different from Medicare. It's really interesting because when they passed Medicare and Medicaid in 1965, it was supposed to be a single system so that it could be expanded into a national system. But Wilbur Mills, who was the Dixiecrat,
from Arkansas.
He was the head of the Ways and Means Committee. He put the poison pill into it. He called it a 3-layer cake. He created Medicare in 2 parts at the federal level and Medicaid run at the state level, and that kept it as a fragmented system that couldn't easily be integrated. It also meant that at the state level, southern states that are less likely to be concerned about the health of their population, particularly their black population, were able to, exclude patients, whereas it's a whole other story, but the roots of this system.
It's another story. Before I turn back to you, Annie, but it's another story. But I mean, it's a story that seems to directly affect what happened at this MedStar hospital, Franklin Square, because that's.
So what's happening now is that these Medicaid MCOs, managed care organizations, they get paid per patient. So the less care they give, the more money they have. And that's what these little clinics that set up and they contract with Medicaid, and their incentive is not to give care. Dr. Dillon was giving a lot of care to his Medicaid patients. He treats each patient the same no matter what their insurance is. So he was losing money for MedStar. And what's interesting is that Washington, D.C. actually kicked MedStar out of their Medicaid program because they had a high rate of denials, which was almost twice as high as the other Medicaid providers. So Medicaid patients would go in for care, get the care, and MedStar would say, we're not going to pay for it.
Let's talk about this in terms of Franklin Square Hospital and the MedStar system. You just said, Margaret, a moment ago that Washington, D.C. kicked MedStar out of the Medicaid program because it wasn't servicing the patients.
Right.
So what are our options here? I mean, what are you all demanding? What are our options here in terms of all that?
Well, the options are that the patients can themselves disenroll for MedStar and become straight Medicaid patients. Now, medical care does say, I think, that you have to be in a provider. Now, Margaret and them are being very nice. But when you get into places like Total Health Care, Jive Medical Clinic, see, I'm just saying, I know I can prove what I say. When you get into those places and they are not giving you, they are trying to save a buck. You understand? These are the kind of things that is frightening for people every day, for people like myself who see people, you know, every day that need health care, but we're being shoveled off to the basement clinics, and those providers does not provide for us or take care of us. We're saying we deserve health care just like anybody else. This is America. Besides that, we live in Maryland, one of the richest states in the United States. What's the third or second richest state in the United States? And we can't even get decent health care. You know, that's a disgrace to this country.
So when you said earlier, Margaret Flowers, that DC closed down MedStar's right to see Medicaid.
Well, they were doing their contracts and they didn't renew their contract.
So what does that mean for us? I mean, how does that play out? How would that play out here?
Well, so this is what boggles my mind, because MedStar is buying up community hospitals, you know, Harbor Hospital, Good Samaritan, Union Memorial, Franklin Square, are, you know, hospitals in the Baltimore area. And patients in those communities have always expected those hospitals to provide them the services that they need. Mm-hmm. And what MedStar is doing, and it's a nonprofit, so it pays no taxes, so that's a huge amount of money, is trying to push poor patients out, push out the unprofitable programs, and do more of cardiovascular, orthopedics, you know, the procedures and things and surgeries, departments that would actually make them a lot of money. MedStar is not having a money problem. MedStar has, I think, looking back at some of their records at the end of June in 2016, they had $1.8 billion in assets. And then they had another $1.1 billion in long-term bonds, which are also tax-free. They're paying their CEOs $1 million to millions of dollars a year in salaries and bonuses. So this is not about, oh, we can't provide these programs because we don't have the money to provide them. They're choosing to put their money not into these services.
So when you were organizing these demonstrations,
Yes.
outside of MedStar and outside of Union Memorial, outside of Union Memorial and Franklin Square, which are both MedStar hospitals.
And Harvard, we're going to do what at Harvard.
So what are the demands?
Okay, yeah.
And what can actually change?
Well,
within the system we have now, I'm just curious.
Yeah, I mean, I think if the state of Maryland were doing its job, it would be looking into MedStar and saying, you're a nonprofit. We expect you to serve the communities that you're in. You can't close essential services. I think that, you know, we should be questioning why MedStar has nonprofit status if this is the way that it's behaving. I would say to MedStar, if you're not going to take care of the patients in your community, then you need to go elsewhere. These hospitals weren't owned by MedStar always, you know, but this is the problem, and this is a national problem. There's an organization or a corporation, Deloitte, they do kind of business analysis. And in 2014, they put out a report that basically told the medical industry, either gobble everybody up as much as you can, or you're going to be gobbled up. And that's what we're seeing. We've seen this mergers and acquisitions that are way beyond anything we've ever seen in the healthcare industry before. And when a corporation owns the doctor's practices, owns the hospitals, and owns the insurance, they have all the power. They can say, well, you're a doctor, you're costing too much, so we're getting rid of you. You know, this is not the way that it should be.
And that's not regulated at all by the state or the federal government?
Well, they own everything. So they're legally allowed to do this. They're legally allowed, as they did with Dr. Dillon. They dropped him without cause. They had no justification for dropping him from their insurance, but they are legally allowed to drop, you know, physicians from their insurance without cause. So, you know, as we know, most injustice is legal, right? That's how they get away with it. But the state should be looking into this. And my question is, you know, what's going on behind the scenes here? Why aren't our state legislators up in arms about this? How much are they getting in donations from MedStar?
Right.
Something I'm sure you'll unearth.
Yeah, but, you know, one of the main demands that we have is that everyone should have a right to choose the doctors that they want. Everyone should have a right to choose the health care that they want, and that they would be treated fairly. We live, again, in America, and when I went to Cuba, I got some of the best health care I've ever had in my life, okay? and nobody was treated any different. Now, if they can do it in a place like Cuba, and point, to a third world country like Cuba, which I don't consider a third world country. I consider it a great place. But anyway, if they can do it, and other, countries, smaller countries can do it, why can't we do it right here in America? We should have decent health care. Greedy companies like MedStar should be put out of business.
And just in closing, what are your next steps?
Well, around the MedStar campaign, we are reaching out to staff at other hospitals to find out what their experiences are. We are connecting with more patients to find out what their stories are. Our next action is coming up on June 4th. And we're just going to continue building this. We're looking into their financials and trying to get as much information as we can. And we're going to continue to expose what's going on, because this is a symptom of a deeper problem in our country of treating healthcare as a profit center, as a moneymaker, instead of a public good, something that everybody needs. And in the bigger picture, we're going to keep fighting for national improved Medicare for all, some type of single-payer healthcare system, because every other industrialized nation in the world has a universal healthcare system, and they spend less than we do, and they have better health outcomes. We're seeing our health outcomes deteriorating. And that shouldn't be happening in one of the wealthiest countries in the world. So, but we're going up against the moneymakers, so it's going to be a fight. We're talking here to Dr. Margaret Flowers and the Reverend Annie Chambers. Good to have you both here in the studio. Thank you so much for stopping by.
Thank you.
And we'll continue to follow what you're doing. And
we're going to beat the giant.
Thank you.
And thank you all for watching and listening as well. I'm Marc Steiner for the Marc Steiner Show right here on the Real News Network, and we'll talk to you all next week.